Hello, I'm Dr. Sindhu, one of reading doctor here today. May I confirm your good name, please? Nice to meet you, Amir. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. Anything else? I'm very sorry to hear about it, Mr. Amir, and I understand your worries that, how a stressful situation would be for you as he is your father. But before I come to the management part, let me confirm, Mr. Amir, if your father is accompanying you today. All right, Mr. Amir, it would have been better if he could accompany so that I would have examined him. But it's okay, Mr. Amir. I'll ask few questions regarding his condition. Okay, is it okay with you? Thanks for your cooperation, Mr. Amir. So, Mr. Amir, can you tell me, does he have trouble knowing the date and month? Okay. And if he uses clothes like newspapers or calendar more than once a day? Okay. Can he manage his daily routine household work like managing money and shopping, preparing food for himself, maintaining hygiene like taking bath and changing clothes? No? Okay, Mr. Amir, can he still drive his car? Okay, sense of direction is decreased. All right, Mr. Amir. Does Mr. Wasim have difficulty finding words to express himself? Okay. And how about his mood? If he becomes irritable most of the time? Okay. And have you noticed that he misplaces his objects, and when he cannot find them, he accuses others of hiding or stealing his objects? Okay. Okay, Mr. Amir, what does he do for a living? Okay, he was a teacher. Okay, Mr. Amir, I'll ask few personal questions to better understand his condition. Is it okay with you? Thanks for your cooperation. So, Mr. Amir, if he smokes, okay, how much cigarettes per day? Have you ever tried to stop his smoking? Okay. And does he drink alcohol? Okay, Mr. Ali. If he had any fall recently, any head trauma, if he had any accident, okay, and if he has high blood pressure, high blood sugar, okay, if he takes any medicine, right. Okay, Mr. Amir, if there is an immediate family member suffering from the same problem, okay, or they are diagnosed with such problem after their 60s. Okay. All right, Mr. Amir. So let me summarize it. Okay, that information you have shared with me today. It is obvious that your father has short-term memory loss, and as you stated, he is disoriented in time and space, and he has functional disabilities in managing daily routine household work, and he has trouble finding words to express himself. And you are much concerned about his health. Is there anything else you want to add, Mr. Amir? Okay, Mr. Amir, I'm here to help, and I'll try best of my abilities to solve its problem. Okay. Yes, Mr. Amir. So for that, I'll offer you a routine test to find out the cause of any treatable disease. Okay. And besides that, I'll also offer you one test called CT scan of the brain. Okay. For that, I'll be referring you uh, um, to a psychiatry department, okay, for initiation and our prescription of CT scan test for your father. Okay, Mr. Amir, if it is feasible for you. Yes, Mr. Amir, the information you have shared with me, it appears most probably that your father has a condition what we call in our medical terminology is Alzheimer's disease, okay, it's dementia, okay, and it is a most common cause of dementia. Okay, Mr. Amir. Yes, Mr. Amir, actually it is an age-related condition due to deficiency of a brain chemical called acetylcholine. Okay, and for that reason, I offer to refer your father to a psychiatry specialist who is expert in such elderly people problem. Okay, Mr. Amir. Yes, Mr. Amir, he may prescribe your father some medicine like donabazil, rivastamine, okay, for mild cognitive deficit. And if your father is found having severe cognitive deficit, then maybe drug like memantine may be prescribed, okay, and the drugs slow down or delay the progress of disease and cognitive decline. If it makes sense to you, Mr. Amir. And let me, and I'll strongly recommend you, that and there is a important role of carer in this disease. He will need help. Okay. So I would like you to take good care of your father and don't let him alone, okay? And take care of his chest infections, okay? I'll strongly advise you to take care of his chest infections, okay? And anemia or UTI, okay, because they can cause confusion, okay, and don't give him anything while he's sleeping, okay. Keep his head side elevated at 45 degree, okay, and after meal for 1.5 to 2 hours, keep head side elevated, okay. And besides that, I'll advise you to give him a notebook to record task, must do, and it will promote some mobile and medication dispenser, okay. And besides that, maintain a constant environment, okay. Do not change the arrangement of furniture and his things, okay, because it will be very difficult for him, okay. And I'll encourage you to arrange for door catches to prevent wandering, and consider for electricity safety alarm, okay, and remove loose carpets to prevent fall, okay, and replace smooth tiles of bathroom while rough tiles to prevent slipping, okay, and modify sleep pattern, and modify steep stairs and arrange well traps for stairs, arrange his bedroom downstairs, okay, and avoid sedatives if necessary, give in low dose, okay, and don't leave him alone, okay. Someone should be with him all the time, okay, if it makes sense to you, Mr. Amir. Yes, Mr. Amir, there will be a time, when he will not recognize even his close relatives or be able to take decision, okay. So for that, I will advise you, that you can legalize his will as advice, as an advance directive in the presence of family lawyer, okay, if there is any such thing in your family, okay. And besides that, psychiatric review by the psychiatrist will be done, okay, at home every month or earlier if needs arises, okay. if it makes sense to you, Mr. Amir. Okay, should I summarize it again for you? Okay, Mr. Amir, is there anything else you want to share with me today? Okay, Mr. Amir, here's the leaflet. It includes all the information regarding your father's condition. I hope it will be helpful for you. Okay, I wish him a healthy life. Okay, take good care of yourself and your father. Bye-bye.